Hi, everyone. Thank you for joining our May Choices Community of Practice Coffee Chat. The topic for today's event is enhancing health communications to empower your outreach. My name is Molly Garrone. I am a Senior Communications Coordinator for the Choices Project at the Prevention Research Center on Nutrition and Physical Activity at the Harvard T.H. Chan School of Public Health, and I am happy to be moderating today's event as always. I would like to acknowledge our funders who make this work possible and share that our Choices work and events are only for research and educational purposes. The intention of our event today is to provide information, tools, and resources to inform and educate, and we are not looking to influence any specific legislation. I also want to note that our guest speaker today has been invited to share personal perspectives and does not speak on behalf of Harvard. If you are unfamiliar with the Choices Community of Practice, we are a network that includes people whose work focuses on advancing obesity prevention, healthy eating, and active living, and want to learn more about how cost-effectiveness analysis can advance their efforts and address health equity. We aim to support these efforts by providing tools, resources, and trainings. Our coffee chats are unique opportunities to share ideas and enhance connections in an informal setting. And today we will start by hearing a presentation from our speaker. We'll then open it up for a full group discussion, and we encourage you all to share questions or comments at any time throughout the event today. So for today's coffee chat, we will be discussing practical tips and guidance for enhancing your public health communications plans, messaging, and outreach tactics. Our guest speaker will highlight examples of local health department-related success stories and share tools and resources that you can use to support your communications work, particularly around promoting nutrition and physical activity. So without further ado, today we are really excited to be joined by Andrea Grenadier. Andrea joined the National Association of County and City Health Officials, or NACCHO, in October of 2015. And is a senior marketing and communication specialist responsible for marketing, promotion, publications, graphic design, social media, brand management, and editorial services to support NACCHO and its members. Andrea worked for over 25 years in communications, promotions, and media and public relations for the public television and radio industry, including the Public Broadcasting Service and Public TV's lobbying group, the Association of Public Television Stations. Andrea graduated with a BA in American Studies from Mary Washington College in Virginia. So welcome, Andrea. We are so excited to have you with us today.
I am thrilled to be here. As I was explaining to Molly, we often keep our heads down in our foxholes, just doing our work and responding to whatever crises pop up. Right now, of course, it's avian flu. So I just want to say I'm very happy to be here. I've been in public health communications for just 9 years, and I always approach my work, as I'm sure all of you do if you are doing communications, with a huge amount of humility. We are always learning, we are always reading, and especially with events like the pandemic, we're always wondering if we and our messages are good enough, if we're hitting the right audiences, if we're carrying the right tone in our communications, and also providing context in a simple way. We always wonder, is anybody listening? Are we using the right words? Who can help to amplify our messages in the communities to the right audiences? And how does our tone come across to people that we're asking to do something? So in the case of the pandemic, that is, we want people to get vaccinated and protect themselves. When we get it wrong, which we do sometimes, and you probably all remember when CDC first said that masks were not necessarily the NPI we needed, but as it turns out, they're very useful. And we have to course correct, and we wonder who is listening now. So communications is the key to all of our work, and it is the one thing that we try very hard to get right. We can't ever lose sight of our audiences. And in the case of NACCHO, ours are the local health departments and all the information that they are communicating in their communities to all of their members.
Thank you so much for the intro, Andrea. And I think we have a little poll question that we want to check in with the group about. So I'm going to go ahead and launch that poll. And so take a few moments to respond. We want to know how important communications is to you in your work. All right. Thank you, folks, for taking the time to answer that. I'm going to go ahead and end our poll and share the results. So very exciting to see that most folks indicated it's extremely important or very important. So hopefully, wherever you're at with your communications, you will be able to pick up a few helpful tips and insights from today's session. So with that, I'm going to pass it back to you, Andrea, for your presentation.
Those were amazing poll results. So I want to thank everybody, especially the people that didn't say not at all important. So we know from, we've done a couple surveys. A couple years ago, we did a project with CDC, strengthening communications at the local public health department level. And we did 2 surveys, and we wanted to know precisely what local health department PIOs were finding useful in their work. What came to the top was mostly infographics and information that they can present to their communities in short bursts, just so they know the messages are simple, different steps, meaning that we tailor it to individual audiences. So we know from NACCHO's recent 2022 National Profile of Local Health Departments that the majority of health departments that responded said they use Facebook and their own websites for general communications with the public, followed by print media, email communications, text messaging, and other social media like YouTube, Instagram, and Nextdoor. For emergency communications, local health departments were more likely to use the Health Alert Network, which I'm sure you all have seen from the CDC, automated phone calling, and a hotline or call center for emergency communications. Few local health departments were actually using LinkedIn, a custom application for phones or tablets, or blogs to communicate with the public. I will say this about LinkedIn is that with the issues that I think Twitter, now X, is having, a lot of people have moved over to LinkedIn. And I know that NACCHO has built its audience to for LinkedIn to about 25,000, which is almost as much as our Twitter feed. And if you note that the messaging, if any of you are on LinkedIn, the messages are getting a little bit more personal and stepping kind of into the space that X seems to be abandoning these days. So I would look towards to LinkedIn to put out a whole lot of information that is useful to health departments. Healthy lifestyles. This is an issue, as you will see, and I just captured 7 of them, that has a huge amount of facets. You see the current narratives include body positivity movement, focus on individual health, empowering people to care about their health, sensitivity of language, the inability of people to be able to afford a healthy diet, food insecurity. What is health department's role in encouraging healthy eating and exercise? Excuse me. And accessibility issues, like how do people gain access to these issues? So I want to pull a circle around all the ways that we think about this issue. As you can see from the list, the narratives around these aspects tend to be more fraught, simply because they're far more personal. We cannot ignore the fact that social media plays a huge role in how people are approaching these topics about body positivity. The culture of health and fitness on all social media tends to be a lot more fraught. When I told a friend I was planning this coffee chat, he asked if I had seen the presentation that Weight Watchers and Oprah did called Making the Shift. And I wasn't prepared for the emotional response that I felt when I watched people tell their stories, which were highly personal, about the destructive and pervasive nature of diet culture. There was a lot of shame, judgment, stigma, as you all know, about how hard it is to live a life that isn't tied to numbers on a scale. So our challenge in communications is to create messaging that can be internalized, that will make a difference in body acceptance. And a few of the takeaways for me dovetail really nicely with communications, because the main one is that representation matters. The messages we use to lift people up have to be compassionate and empathetic and have to understand where people are coming from. It's important for people to see themselves in the messages that we convey. The others, when we talk about how the people who are leading this, they can be you, they can be people in your community, they can be national people who have a voice in the whole body positivity movement. So despite how pervasive the messaging is with influencers, TikTok, it's been interesting to see that in the last month, TikTok began enforcing new guidelines in its integrity and authenticity policy that prohibits users from using marketing weight loss products. And they're trying to rein in promotion videos as well. And the new rules are intended to block body shaming imagery and related harmful messaging. And it also restricts posts about disordered eating. So while the new community guidelines still are somewhat ambiguous, I imagine they'll be strengthened in the future. I mention all of this as a preface to about messaging. One of our biggest challenges is to get this messaging right, and there's a baseline from where we can start. Every health department's mission and their goals is to keep their communities healthy and safe. So empowering people to take charge of their health by giving them the tools and resources they need, such as creating a group for people to share their progress, is a really good start. And health departments, next slide, don't have to start from scratch because there are a lot of resources out there that are designed to help you frame your campaigns in the appropriate way. So Move Your Way was developed by CDC's Office of Disease Prevention and Health Promotion. And a pilot test of this campaign, it was in 2020. And so they did a web-based cross-sectional survey to see if there were results. And so in the pilot evaluation of the 8 sites, exposure to Move Your Way is associated with higher odds of being aware of the guidelines, knowing recommended dosages, likelihood of becoming more active in the future, high physical activity, self-efficacy, and making a physical activity behavior change, as well as higher activity levels. Next slide. So you can see, for example, the Mississippi State Department of Health in Jackson County posted some really impressive numbers. Those earned media impressions are literally the stuff of dreams for communications people. So they did a terrific job of reaching deep into their community for their pilot project. Next slide. Here's another example of a great campaign, Walk Cabarrus Community Challenge. So this is a pilot that they did, which used the physical activity guidelines and the community playbook, which is a comprehensive tool to track progress and evaluate success. And they use the tools from the playbook, but they also produced a whole lot, as you can see, of collateral to go along with the walk, with the water bottles and pretty much everything that had to do with the Move Your Way campaign. And this was across all ages. It will be probably listed in the resources, but we did a issue brief that talked about all the 8 sites and all of their progress that we did at NHO. Next slide. So the work we do in communications, everything we do is really about trust. We want the people that whose lives we are trying to support trust us with pretty much everything the health departments do that supports their community. So that includes engaging people across all communities, using empathy and delivering clear, simple messaging. So building trust should be hardwired, which I believe it is, into pretty much everything we do. And the information that we are delivering is science-based, and it's supported by established practices. And the main thing is to keep your messaging simple and clear, share stories, and being out there in the community. I think there was a question in the chat about earned media. When you are posting ads, for example, if you have an advertising budget or a media budget, that is when you're talking about earned media. They're ads that you place in local newspapers. Generally, you can get your local TV station to do PSAs. But the earned media are it's the ones that you are actually paying for media placements. So next slide. So when you're building a communications plan, and I know this sounds very simple, but this is where I always start. Who needs to know the information? What do people need to know, and who needs it? And how do they want it? I would add, what is the delivery mechanism? So we start with knowing your audience. You tailor your messages to all of your various audiences, and figure out the messaging that is going to resonate with them. If you know that people in your community are vulnerable, for example, in case of thunderstorms or flooding, you make sure that your messaging is about cooling centers, places where they can go, places where they will be safe. And if you keep your messages concise and simple, that just means avoiding jargon or any complex language that may confuse them. When you're getting information out, use the channels that are most appropriate. For example, most of our health departments are on Facebook, and they have a very robust way of communicating with all of their audiences through Facebook. And our health departments do incredible work on Facebook. Well, they do incredible work anyway, but on Facebook, the graphics are rich, they are dynamic, the text is simple. And I spend a lot of time reviewing what our health departments are doing on all their social media. And I have to say, it's always been really very top of the line and very impressive. Consistency is key. So make sure that across all of your mechanisms or all of the ways that you're communicating with people, that those messages are cohesive and there's a cohesive experience. For example, you give people information in case of extreme weather. Tell them what is happening, where they can go, who can help them, what they need, and that sort of thing. And those messages should be spread across all of your audience. And they can be absolutely consistent with each other if you just keep them consistent and keep them strong and keep them simple. Two-way communication is also very important because you want to encourage feedback. You want to know from your communities what exactly is resonating with them. You also want to hear the things that aren't working so you can fix them, because if you don't know what the issues are, you really can't address them. Next slide. Our partners do some pretty amazing promotional work. So this, as you can see, this week is Healthy and Safe Swimming Week. So the CDC has rolled out a whole lot of resources for health departments to use. This year's theme is Prevent Drowning, Swim Lessons Save Lives, because in a recent MMWR, they found that there's a very high percentage of people that do not know how to swim, and drowning deaths have increased. So look to your partners for promotional toolkits. Another group that started around to respond to COVID-19 information is the Public Health Communications Collaborative. And they did terrific work all through the pandemic, mostly their infographics. And the speed by which they could produce these things and get them out to health departments was really very notable. So rather than sunset the organization has, it's going to continue and has a new executive director. And they also have a lot of terrific resources. Next slide. Trust is it's a very difficult topic because I think in a lot of ways we are all still living very much in the shadow of the Tuskegee experiments. Those were the experiments that were inflicted on minority populations in the name of science and public health. So there are many ways in which public health has to work pretty much every day to keep proving itself that it can be trusted. And I can't emphasize enough the importance of listening to your community when you craft your communications plans. So these bullets pretty much emphasize about taking history and people's experience into account, listening to those community voices. And one of the most important things we found during COVID is finding people in the communities to serve as trusted messengers of vital information. Pretty early on in the pandemic, this became very much a theme, is like find those people who can reach into the communities. And during COVID, a lot of really interesting and effective projects were started to reach people. One of them was one that we did with the White House called Shots at the Shop, in which they had people at barbershops and beauty salons telling people more about vaccines, how they could trust them, and some actually set up vaccination centers at the beauty salons and the barbershops for people to get vaccinated. So that's an example of just truly getting deep into your community to serve them as best you can. Culturally relevant stories that resonate with your community are also really important. The Italian writer Primo Levi has an expression, troubles overcome are good to tell. And I think stories can create just an incredible emotional connection. They can also convey complex information. They can help reduce stigma. They can evoke empathy, which is something that everybody needs to make health information a lot more personally relevant. So people, when you are giving them messages about what they need to do, that they trust you. And so this is how we build community, by building a sense of solidarity and support and fostering an environment where people feel safe to share their experiences, advice, and resources. Next slide. And again, this is something we've already talked about, but I can't drive home enough the key communication strategies to address healthy lifestyles. Avoid jargon. Make your visual content, which a lot of you do already, engaging and memorable. Your social media campaigns have a huge amount of leverage in your communities to reach wide audiences, promote healthy eating and exercise habits, especially when you're sharing success stories, because everybody loves a success story. I go back and forth sometimes when it comes to influencers, because I can see where if something were to happen with a very famous person that was somehow counter to the messages that they're delivering, that can be problematic. But during COVID, one of our health departments in San Antonio had a Tejana singer give messaging over the radio in Spanish and reached deep into the Hispanic community to get people information so they know where to get vaccinated or why they should get vaccinated. And this is a beloved singer who everybody, they trusted her, they loved her music. And so her messaging was effective and powerful. In my community in Alexandria, Virginia, we have a new health department, and our health department, which is a wonderful thing, it feels like it's everywhere, which is great. So they're at the farmers market. They have a lot of events, workshops. They've done partnerships throughout with schools and community organizations. And so these are just some of the ways in which you can enlist partners to help you get your messaging out. Next slide. Here's where we're reminded once again to use behavioral science principles to encourage behavior change. Think of small achievable goals and providing incentives for healthy behaviors. Um, when you can also personalize your messages by tailoring your communications to the individual preferences of your audience. Um, consider factors such as age, gender, cultural background, and socioeconomic status when you're developing your messaging and content. Education, it's something that health departments do better than anybody else to provide accurate information about the benefits of healthy eating and exercise, and offering ongoing support and resources to help them maintain healthy habits over time. But most important, I think, celebrating successes and letting people recognize their own humanity by being proud, giving them the opportunity to be proud of their achievements. And those stories also help to inspire and motivate others to adopt healthier behaviors. Next slide. Choices has a lot of really great information, and they have a national action kit. And these are all the information from Choices obviously is based on their evidence-based strategies. And they have all the scientific evidence that benefits health. So the URL is right down there. So I hope everybody takes advantage of what the Choices Network has to offer. And now oh, okay. So we have another poll, and this is something for my own interest, is how many of you are using social media on a daily basis? Now, the one thing we found during our Strengthening Communications project is that not every health department has a dedicated communications person or a PIO. So we're always interested to know who is using it, or who on staff actually has responsibility for social media. So social media tends to be a double-edged sword in so many ways. But the beauty of it is there are a lot of channels to get your messages out, depending on what your audience and what your community members are comfortable with. Most of them are going to be more comfortable with Facebook. A lot of them are on Pinterest, getting ideas for all kinds of things. LinkedIn for professional issues. Your health department may have a YouTube channel, which is terrific. And of course, the pressure these days to be on TikTok, I think, is pretty strong. But the thing with TikTok is you need to churn an awful lot of content to rise to the top in the algorithms. But it's still, if you do have capacity, it's still a great way of getting your messages out. It would be interesting to me to know where you all go for communications guidance and resources. This is excellent news, a regional PIO. I love that idea. Among the resources is something we put together for our Strengthening Communications project a couple of years ago. It is a social media toolkit, and it is a primer from A to Z for local health departments. The information is for people just getting started, but it's also a lot of more advanced about how you connect with your communities. I recently, I updated it back in 2021 to add a section about crisis communications, focusing on COVID-19 resources. And that's my presentation, and happy to take questions. And thank you very much for listening.
Wonderful. Thank you so much, Andrea. That was such a great presentation. We really, really appreciate you. I feel like you shared such a wealth of information and resources. And thanks to Angie and Stephanie and our team who are putting links to all the great resources in the chat. So really appreciate. It was great to hear all your points about the importance of building trust with communities, really knowing your audience. I know that's one of the most, if not the most important thing in communications, really. So I love that you really highlighted that and talked us through, and great examples that you shared. So thank you so much, Andrea. And I think at this time, I'm going to kind of move us into our Q&A and group discussion. So folks, get thinking about questions that you have, and feel free to put those in the chat. You can also feel free to come off mute and just ask your question too. We encourage both. But maybe while folks are pondering a little bit, I do want to ask, so crisis communications is such a big part of public health communications, and I'm curious if you could share some insight into what kinds of steps organizations can take sort of to prepare, so kind of some preparedness focused steps, and then sort of after the fact, when a crisis is occurring, any examples or tips for crisis communications?
Sure. First, I want to say I realize that is an awful lot of information that has been thrown at you today, but I just want to invite anybody who wants to chat or check in by email or Teams or whatever, that I am always accessible. And I love talking to health departments about what they're doing, what they're trying to do, what they're thinking of doing, and what might work. So seriously, for all of you, I am all ears. So crisis communications is something that um, it's communications. It's just really fast. And so whenever there's a crisis, right now we are dealing with I guess people's concern, from what I'm picking up on social media, about HPAI, avian flu. And the CDC has been absolutely terrific in getting out information about it as quickly as possible. But there are also groups that are setting up wastewater analysis sites to focus on HPAI. So I would say for crisis communications, be fast, but be accurate. Be honest, frank, and open. And the thing is, when a crisis unfolds, and I would use the example of a natural disaster, you really do not, situational awareness comes second by second. And so it's really hard to gauge exactly where you are, but being honest with your audience and say, here's what we know right now, and it can change any minute. So being honest and frank and very open about not only what you know, but what you don't know, but you're anticipating, is really, really useful. Empathy also goes a long way when you're in a crisis. Whether it is, I tend to go back to natural disasters because climate change is going to have a huge effect on pretty much every aspect of our lives in so many ways. But it's hard not to do this, but I would say do not speculate. Just focus on the facts as you know them at the time. Be very clear. Keep your messaging simple. And be attentive also to new and old media, because you might be what mostly people do in a natural disaster is they have a press conference, and the press conference will feature the mayor, the head of emergency preparedness, all the people, somebody from the police, people from the public who will be there to be your trusted people. And so the press conference, which has been around for hundreds of years, not unlike myself, it goes a long way towards making people feel that they have leadership in their city, county, town that is reliable, that they can trust, that they could put a face and a name to, which is incredibly powerful. So the old-fashioned press conference is still a really great way to go. New media, however your community gets media, whether it could be next door, it could be Facebook, it could be Twitter, but to capture as many people as possible, as quickly as possible, and to figure out whatever medium you use to do that is, I think, very effective. During the pandemic, I was on Nextdoor a lot, telling people about vaccine safety and things like that. And occasionally I would just get immediately sandbagged by people saying, no way, we're not doing this. And so I'm like, but I just kept at it. And slowly but surely, you could see that people were responding to the messages because they were science-based, they were evidence-based. And so I feel like, we made a little bit of progress, but it's always going to be hard because people are responding from their own personal experiences. And as hard as it is sometimes to respect that when it isn't science-based, we are always dealing with in public health the political headwinds of pretty much everything that is going on. And that's another consideration is things that are basically scientific that have been made political is it's difficult. But what we have to do is just keep focusing on the facts, on the science, on what works and what we know to be true. And I think that we can have our communities become a lot more trustworthy, even more than they are right now for the health departments, because the health departments are doing the best work they can, and they're doing amazing work at being responsive to their communities and supporting them and uplifting them as much as they can.
Thank you, Andrea. That was so helpful. And thanks for underscoring just again the importance of, sticking with science-based and evidence-based responses and, information. I think that's great to underscore. And I want to lift up in the chat, Don mentioned better to be upfront rather than just react, which I think is such an important point that you were certainly saying, but appreciate that engagement. I also want to note, just in case folks didn't notice, there was a question about getting a copy of the slides. I believe we will be sharing the slides after this, so thank you for asking about that. And I do also want to highlight that Angie on our team has shared a link to the Harvard Chan School's Center for Health Communication. So this is a great center here at our school that has a wonderful resource library with some great tools for communications in public health. So I encourage folks to check that resource out as well. So somewhat along those lines, there's a great question in the chat from Shelby. How do you recommend finding a balance between encouraging two-way communications and then chat or comment sections that might be inappropriate or off topic or filled with misinformation or disinformation? I know that's a big issue in communications today.
I'm having flashbacks right now about all the times that I have been, or I'm one of the social media managers at NACCHO, our Twitter feed during the pandemic, and just how quickly you can get sandbagged. But I think that when we stay on topic and the problem is it's good to have those comments and that feedback, but some comments you just have to take with a grain of salt. There are a lot of people who are going to be angry with an axe to grind, and I'm not sure how much attention you should give them. I would say read the comments, but I think in a lot of ways, I would recommend not responding to them. But when you do your subsequent comments on those posts, if you do them, clarify what it is that person seems to be concerned about. And generally, they will come back with something else. But it's hard because I go both ways on this, because I tend to be highly reactive about things. And when I see something, I just want to respond. But then if I give it time and then perspective, do not jump on it immediately, because you'll be seen as somehow adversarial. Give it some time, give it an hour, give it a couple hours before you formulate a response. And I can guarantee you the response that you come up with an hour later is going to be very different than the one that you really feel like saying. But I think that it always helped me during COVID because we were working. I have to say, in some ways, quite honestly, I am haunted in some ways by not being able to find the messaging all the time that I needed or create the messaging that would have an effect on people. I kept thinking there's something there that I am missing, but it really wasn't. But what I think we have to tap into when there is a crisis like that, like a pandemic, tap into the fact that you understand that these people are afraid. And fear is what is motivating a lot of their responses, a lot of their comments, a lot of their skepticism. And so I think approaching them sometimes with a great deal of compassion, it's hard. I mean, I'll admit it is hard, but it helps. We're not going to get, and years ago, I was talking to somebody at CDC about vaccine skepticism. And I'm from the generation that remembers very vividly the day that when I was 2 years old, lining up for the polio vaccine. And we were talking about what works and what doesn't work. And he said, I think you have to recognize that you're not going to get everybody. You're going to reach a lot of people with science-based, evidence-based information, but you will not get everyone, and you have to be okay with that. And so the reactive me says, no, I want everybody. But I have to be honest that we are not going to get everybody, but we can get the people who are somehow vaccine hesitant, who are on the fence, but need a little bit more information to make their decision. But getting people who literally refuse to follow science in the name of protecting their community, we're not going to get them all. And I think it's hard to be okay with that, but it's just, and I'm never going to be okay with that as a communicator. But I think all we can do is just try the best we can and get as many as possible.
Thank you, Andrea. I think those are some really great tips and suggestions. That is such a difficult problem. So I think you presented a very reasoned approach and really appreciate that. I also want to highlight for folks in that link that was shared before to the Center for Health Communication, there is a really nice, some guidance in there, particularly about misinformation too, that I think folks might find useful. So I just want to lift that up. We will not be holding a June coffee chat, but instead we will be having this really great opportunity. NACCHO, where Andrea works, is hosting a series of webinars in partnership with the Centers for Disease Control and Prevention Research Centers program, which we at Choices are a part of through our Prevention Research Center at Harvard. And on June 4th, members of our team and partners from the Boston Public Health Commission will be coming together to present during the second webinar in this series that they're doing. And we'll be talking about building community partnerships and using cost-effectiveness analysis to promote healthy eating and physical activity as part of a 5-year project that our teams have been working together on. So I really want to invite everybody to attend that. Again, it'll be Tuesday, June 4th from 1 to 2 p.m. Eastern time. And I will pop a link in the chat so folks can register for that opportunity. And I do also want to highlight, thank you so much, Stephanie from our team has put in the chat a link to our Choices Community of Practice portal. So I encourage folks to get on that site and register if you have not already done so. We have lots of other exclusive tools and resources that you can access through there, including a member directory, so you can connect with others. So please feel free to do that. So I just want to say a huge thank you again to Andrea. This is really, really great. And thank you, Andrea, for highlighting in the chat about connecting directly with Jennifer. And I know you
Yes.
mentioned earlier that folks could follow up with you as well. So maybe we can share out your information if that sounds good.
Absolutely.
Wonderful. Well, thank you again, everyone. I hope you have a great rest of your day. And thank you again to our speaker, Andrea.
Thank you. Thanks, everybody.
Thanks, everyone.